Peds and fundamentals tonight. So we've got 50 questions, and we'll be, why don't we just jump right into it? All right. Amber said, thank you so much for the plan. Definitely recommend that to anyone in need of structure to get one. Awesome. Yep. So guys, again, you can find the link to the custom study plans in the link in my bio. All right. That being said, let's jump right into it. All right. Let me just find my fact here. Okay. All right. Question number 1. Nurse assesses a child with suspected Kawasaki disease during the subacute phase. Which finding requires immediate intervention? Oh, I did. Apologies. So, anyone know why C is the correct answer there? That's my fault. So with the sudden gallop heart rhythm, the gallop here suggests myocarditis and impending heart failure. So it's not A, all right, because that peeling of the hands and skin, that's expected at this stage. B, irritability is chronic in Kawasaki and just not the emergency. And D, that low-grade fever after the IVIG is not the critical danger sign. Okay, so apologies. Hopefully, that should not be. I'm sorry, I put the answer on that question. All right, so let me pull this down a little bit. Okay, here we go. All right, which action is most appropriate? What are we thinking? So you guys, a lot of you are jumping on D, and I'll tell you that for D, it's actually going to be incorrect. So that's the adult way of measuring how long to place an NG tube. The pediatric length can vary, and so you need to follow your facility guidelines. But the answer here that we want, that is definitely the case in all situations, is B, asking the child to sip water during insertion. Okay, so that sipping water supports safe, coordinated swallowing. Okay, good job to those who got that. All right, the nurse receives report on 4 pediatric clients, which requires first assessment. Which requires first assessment? Yes, that last question was B. All right. All right, let's think about A, B, C's here, right? So the majority of you are marking C, and that's the correct answer, okay? That stridor at rest signals some sort of airway obstruction, which we need to address immediately, okay? It's not A, increased use is concerning, but not the top emergency. B, significant dehydration is always a risk, but airway is gonna beat it every single time, okay? I don't think anybody put D. All right, so question 4. A nurse prepares to administer a unit of packed red blood cells to a toddler. Which action is the priority? Which action is the priority? Okay, this one feels like a gimme. I hope it's a gimme. Yeah, overwhelmingly, I don't think I've seen a wrong answer yet. So yeah, B, you have to verify that blood product with another licensed nurse, okay? So verification is going to be the highest safety step to prevent a fatal mismatch. So I don't think we need to go too far into that one. Yep, absolutely not C or D. Definitely B. Okay, perfect, guys. Good. All right, a school-age child with nephrotic syndrome has a daily weight increase of 1.5 kilograms. Which intervention is most urgent? Thank you guys for all the follows. I appreciate that. We are going to be doing these lives every Sunday, Tuesday, and Thursday. All right, at 9 p.m. Eastern Standard. If you guys are out there on the For You page, come on in. We're going to be going to 50, doing fundamentals and Peds questions. All right, so I've been seeing some, basically B and D with no real consensus. All right, so the answer here is going to be B. All right, I'll tell you why. So any rapid weight gain suggests that there's some severe fluid retention and a possible relapse. All right, D, although helpful, not the urgent action here. Okay, and A is wrong because fluids are often going to be restricted, and it's not C because supplements aren't indicated here without documented hypokalemia. All right, C, 6. All right, the nurse is preparing to suction a tracheostomy on a preschooler. Which action is correct? Trudy, thank you for the follow. Which action is correct? All right, again here, overwhelmingly looks like you guys are going with B, and that is correct. Pre-oxygenating before suctioning. So children will desat quickly, so pre-oxygenation is critical. All right, don't think I saw any other answers on that, so good job. Not going to go into full detail there. All right, 7, the nurse evaluates a child on TPN. Which finding requires immediate attention? All right, I just posted a video today or yesterday, may have been last night. Time escapes me right now, but it's a quirky video, me doing a terrible dance with my daughter as my co-star. She killed it, and it is all on what are these red flag words that you see in these questions. And if you see these red flag words, that should be a big clue to you. You need to look at that. And here, the red flag word is new. Okay, so D is the answer. Right upper quadrant pain can signal liver dysfunction or a gallbladder complication. So Amber said, it's an awesome video, killed it. Hey, you know, I try, do what I can. My daughter definitely carried that video. So it's not A, mild hyperglycemia is expected. And B, hunger can happen despite TPN. And C, well, increased urine output's expected with the high osmotic load. I heard somebody say, Kaylee said, I got a 94 on my NCLEX predictor exam today. Awesome. Everybody drop a dub for Kaylee in the chat. That's awesome. Proud of you. Keep going. You're going to kill this test. All right. Oh, sorry, guys. I'm losing my spot. All right. And we'll make it smaller. All right. A 5-year-old with cystic fibrosis is receiving pancreatic enzymes. Which statement by the parent indicates effective teaching? Which statement by the parents indicates effective teaching? All right, you guys are a lot of C's and a couple B's. All right, so answer here is going to be C. I'll give the enzymes with every meal and snack. All right, because enzymes must accompany all meals and snacks in order for absorption to happen. I think D was the only other one I saw. So D's wrong because they are required, okay, if the child eats anything. The answer to the last question was D, new right upper quadrant pain. That was the answer to 7. Okay? All right, good job, guys. Let me see where I'm at here. And 9. The nurse prepares to discharge a child post-tonsillectomy. Which instruction is the priority? Which instruction is the priority? Somebody is yelling B. All right, seeing B's mainly and some C's. All right, yep. So the answer here is going to be B. Watch for frequent swallowing. So frequent swallowing indicates bleeding, which is the main post-op risk when we're talking about tonsillectomies. All right. A is wrong. You want to avoid red liquids because that will mask bleeding. C's coughing risks, dislodging any clots. And D, well, any mild odor for a short time is normal, but not the priority. Okay. Here we go. 10. A nurse is caring for an adolescent with sickle cell crisis. Which intervention is the priority? For those of you joining, guys, we are going to 50, and this question set is on fundamentals and pediatrics. All right, NCLEX style questions. So welcome in. If you guys haven't already, you can go ahead and follow. If you haven't, we do these lives every Sunday, Tuesday, Thursday at 9 p.m. Eastern Standard. All right, I'm seeing lots of B's for number 10 here, and that is going to be the correct answer. So administering high flow oxygen is going to be the priority out of these options. So hypoxia triggers sickling, and oxygenation is going to be crucial. Okay. Let's see, what else was there? A, ambulation during a crisis really just increases oxygen demand, which is the opposite of what we want here. C, you want to use warm compresses, not cold. And D, opioids are indicated for severe pain. Okay? All right, 11. And if you guys see one of your peers ask a question in the chat, and you feel confident enough just to answer for me, that is great. I appreciate it because I am not able to get to every question. We need to try to keep this moving. KG says she takes her NCLEX tomorrow. Good luck, KG. You got this. Which finding requires immediate intervention? All right. Seeing A's and C's. All right, the main answer here is going to be C. All right, that respiratory rate of 68. Okay, a respiratory rate near 70 risks fatigue and possible respiratory failure. All right, A is wrong because early distress, because nasal flaring is an early distress sign, but not the emergency here. Okay. B, mild retractions are common in bronchiolitis, and D is expected. Okay. All right, 12. All right. The nurse prepares to give oral medication to a toddler. Which technique enhances safety? Thank you, guys. Oh, we're on a little follow spree. Uh-oh. Thank you guys for all the follows. It helps out a ton. All right. Which technique enhances safety? All right. I'm seeing a lot of C's and B's. Okay. So, yep, the majority of you said C, which is the correct answer here. C, using the smallest volume possible is going to reduce the aspiration risk. So what else did you guys say? D. D is going to be wrong because sitting upright prevents aspiration. Okay, so we want them to be sitting up. All right. I don't think I saw, I think B and D, A was being said. A is wrong because if the child doesn't finish the bottle, the dose is inaccurate. Okay. All right. Good job. Good job, guys. All right. The nurse notes a pressure injury forming on a bedbound child's sacrum. Which action is best? No. Which action is best? All right. Yep. Overwhelmingly, it's going to be C, repositioning at least every 2 hours. So that's going to decrease pressure and stops progression. I don't think we need to discuss that one too much more. That was pretty obvious. So good job. All right. A child receiving digoxin has a serum potassium of 3.1. Which action is the priority? All right. Okay, yep, overwhelmingly here, it's going to be A, hold the digoxin dose, because the hypokalemia increases the digoxin risk toxicity. Okay, so when you give digoxin, know what the potassium level is prior to. Okay, why not C? Well, potassium's low. Restriction is going to make it worse. Okay. All right, 15. A toddler is admitted after ingesting an unknown amount of acetaminophen. Which lab is most critical? Which lab is most critical? All right, yeah, these are pretty easy so far, I would say. Yep, the majority of you are jumping on B, that liver function, right? Because Tylenol is going to be metabolized in the liver, and so we want to see what that liver function test says. All right. I don't think there was any other answer here that people popped in on. So yeah, liver function test is the priority. All right. And 16. All right, the nurse cares for a child on continuous pulse ox. Which action ensures reliable readings? All right, thank you guys for all the follows. And thank you guys for answering your peers' questions about some of the past questions answers. I appreciate that. All right. You guys are just devouring C right now, and you would be correct. All right, so changing the site, so the site rotation prevents skin breakdown and inaccurate readings. All right, it's not A because that will causes burns or breakdown. All right, Shelby, these lives are going to be Sundays, Tuesdays, and Thursdays at 9 p.m. All right, set your watch, set your alarm for it, and I'll make sure, and if you're following, I'll have a story posted each day that you can register for the link. You can register through my story so that TikTok sends you a notification when I go live. All right. Absolutely, you're welcome. All right, a child with a VP shunt presents with irritability and vomiting. Which additional findings suggest shunt malfunction? All right, you guys kind of all over the place. All right, the majority of you are saying D. That would be incorrect. So the answer is going to be B, sun-setting eyes. Okay, so sun-setting eyes. It's a downward deviation of the eyes, which indicates increased ICP. Okay, so sun-setting eyes is a downward deviation of their eyes, which indicates an increased ICP. All right. So it's not A, increased appetite is not typical in ICP. It's not C, a bulging fontanelle is going to be expected, not flat. All right. And it's not D, bradycardia will occur late. Sunsetting eyes appears earlier. All right. So it seems like that one tripped up a lot of you, but hey, we're here to learn. Okay. Again, bradycardia occurs late. Cushing's triad is going to be a late thing. Okay. If we're seeing signs of Cushing's triad, we're kind of screwed. Okay. 18. A nurse evaluates teaching for parents of a child with a new gastrostomy tube. Which statement indicates correct understanding? All right. Then again, thank you guys for answering each other's questions. You got like built-in moderators here. All right. Majority of you are saying B, it appears. And I will tell you why that's wrong. It's okay. Just laugh, guys. It's okay. So the answer here is going to be C. All right. We will rotate the tube daily once the site heals. All right. The rationale is daily rotation prevents buried bumper syndrome once it's healed. Okay. So it's not B because residual checks vary by policy and are not always required in pediatrics. Okay. Residual checks vary by policy and are not always required in pediatrics. Okay. Judge, bruh, what? Like twist. All right. So, not D, tubes should be flushed routinely. Okay. What else? Not A, a G-tube tract can close quickly and medical placement is required promptly. So, all right. So, 19. Yes, this is NCLEX prep, friends. All right, 19. A pediatric client on isolation pulls off their mask while being transported. What should you do first? What should you do first? All right, majority of you are saying A, and yeah, that's the obvious answer here. All right, so replace the mask to reduce exposure, right? What else did you put? C and D. So not C, notification isn't the first step here. And D, is not the priority. Okay, when we're talking about just an exposure situation. Okay, 20. Ba, ba, ba. All right, a nurse performs a safety assessment in a pediatric ward. Which finding requires urgent action? All right. Thank you guys for all the follows. Appreciate it. Holy moly, we got 540 people in here. All right. Majority of you are saying C, and that would be correct here. Okay, so side rails up, but crib wheels unlocked. All right, so that's going to need corrected. Don't think I saw any other answers in the chat that told me that you guys didn't understand that. So good job. We are going to 50 questions, Tiffany. 50. All right. A nurse assesses a 2-year-old with presumed viral croup. Which finding requires immediate intervention? Iva, thanks for sharing the live. Appreciate it, guys. All right. Diamond, thanks for the roses. Appreciate it. Okay. Majority of you are saying C. That is the correct answer here, guys. So when we're talking about, when you see an answer, anything that says that there's a kid drooling, we're thinking epiglottitis, okay, which is a true airway emergency. All right. A is just classic croup. B, that's expected with laryngeal swelling. And D, the mild inspiratory noise during crying does not equal impending obstruction. Okay? All right. So, 22, sorry. Here we go. A toddler with severe dehydration is receiving isotonic fluid boluses, which finding indicates therapy may now be harmful. All right. Yep, absolutely, guys. And I think all of you got this right. So yeah, it's going to be C, the new crackles into bilateral lung bases, because that is in the question that's indicating possible fluid overload. Okay. So that is dangerous and rapid rehydration. So you need to keep assessing your patient, listening to those lung sounds. All right. Okay, 23. A nurse floats to Peds. Which assignment should the charge nurse refuse to give her? Okay. So in other words, if you're saying this question in your own words, which of these assignments has the unstable patient in it? Right? Because that float nurse should not be getting an unstable patient. All right. A lot of you are between B and D. A couple C's. Yeah. So answer here is going to be B. All right. We're talking airway, breathing, circulation. So that 3-month-old with bronchiolitis on high flow nasal cannula, anybody on high flow requiring a lot of oxygen is going to be considered unstable. All right. So that, let's see, is that a 3-month-old? So yeah, we're talking about an infant on high flow oxygen. That's going to need experienced pediatric staff, okay? A is wrong, that they are stable and appropriate. C is wrong. Controlled seizures is another way of saying stable here. And D, straightforward, that's straightforward IV medication care, okay? So good on you guys. I think a lot of you didn't get that. All right, 24. A child with DKA is receiving IV insulin, which finding requires immediate intervention. Which finding? Make sure to read all the answers. All right, we're talking about they're receiving IV insulin. Right. Okay. So the answer that should stick out to you here is C, headache and slowed responses. So that sort of neurological decline suggests that there might be some cerebral edema going on. And D, which is basically DKA's worst kind of complication. There could also be some sort of hypoglycemia going on too. All right, but yeah, a cerebral edema is kind of the big thing to watch out for there. So it's not A, that's mildly low, but it's expected as the insulin shifts to potassium. B is incorrect because that's an acceptable rate of decline, and D is wrong. That's adequate urine output. All right, for a P. Okay, good job. Good job. 25. A nurse prepares to give a packed red blood cell transfusion to a child with anemia. Which action is the priority? All right, I think this was, I apologize, this is another, well, it might be new to like 300 or 400 of you, but there was another question like this earlier. And yes, the answer is going to be C. We're going to verify that blood product with another licensed nurse. Okay, we cannot cannot give blood without verifying it with another nurse, okay? Hold on a second. We had that one too. We had this one. We're jumping into 27 here. All right. A nurse notes a 5-year-old's oxygen sat reads 79%, but the child is pink, chatting, and eating crackers. What should the nurse do first? What should the nurse do first? Yeah, exactly. It should be B. Like if it's saying 79, but they don't look like they should be reading 79, yeah, we're going to check that probe and just reassess, make sure we're getting a good waveform. There's probably artifact. You're not getting a good pleth. So you just reassess first. All right. Yep. Kids are super wiggly. So definitely check that out. All right. A school-age child with a new central venous line, which finding requires immediate intervention. Okay, I see a B and an A. All right. Awesome. Majority of you are saying A and B. So the correct answer here is going to be A, that child reporting chest pain during infusion. So chest pain during infusion could suggest that there's some sort of catheter malposition or an air embolism. All right, so we need an immediate intervention there. B, oozing at the insertion site. Here it's going to be wrong because minimal bleeding can be expected initially. You want to monitor it, but it's not going to be the priority. So that's sudden. Again, child reporting chest pain during infusion, that's not normal. Okay, we need to look for things that are expected versus not expected. We're not expecting chest pain during infusion. And I go live Sundays, Tuesdays, and Thursdays at 9 p.m. You can set your watch, okay? Sundays, Tuesdays, Thursdays, 9 p.m. If you haven't already, you can go ahead and follow, and then probably will pop up for you more on the For You page, or I always post it on my story, a link that you can register. And then if you register for the live, then TikTok will send you a notification whenever I go live. Yep, thank you guys for all the follows. Hell yeah. Thank you. That's amazing. Appreciate it. All right, so you received shift report on 4 clients. What child should be assessed first? Yeah. Okay. Yeah, of course. We're looking at ABCs. Which one is least stable, and airway's going to win here, right? So that 3-year-old with inspiratory stridor indicates that there's some sort of impending airway obstruction. So it's not A. Those are just mild GI side effects, and those are common when we're talking about antibiotics. All right. So not A. I don't think I saw any others. So good job. We are going to 30. A nurse administers digoxin to a 1-year-old. Which assessment indicates the medication should have been held? All right. Oh my, we have eclipsed 600 people in the live for the first time ever. Fantastic, guys. Thank you so much. Answer to 29 was C. Okay, that kid with respiratory stridor. All right. So 30 here, we're talking about the 1-year-old getting digoxin. The correct answer is going to be A. All right, I see a lot of A's and D's. So A here, that apical pulse of 88. Okay, because we're talking about a 1-year-old, an infant. So for infants, you hold digoxin when we're talking about a heart rate between 90 and 110. Okay, that sometimes depends on facility policy, but that less than 90 That 88 is already low for a 1-year-old. Okay, so we need to hold that. So this is just a kind of kick in the ass that you need to know your pediatric vital signs. Okay, they're little humans. Things are weird. So, but you got to know those for something like this. All right, so B is wrong because a heart rate of 106. Let's see, heart rate of 106. They're saying it's normal. YC is wrong. One isolated vomiting is not diagnostic here of toxicity. And it's not D. Periorbital edema is nephrotic syndrome related, not digoxin toxicity. Okay? Here we go. 31. All right. A nurse educates parents on toddler's new gastrostomy tube. Which statement indicates correct understanding? All right. Seeing lots of good familiar names in the chat. Thank you guys for coming back. Appreciate it. And thank you guys for all the new follows. For those of you who are just jumping in, we do this Sunday, Tuesday, Thursday, 9 p.m. Eastern. If you haven't already, you're welcome to follow above. We do this, and there's lots of good content on the actual page. All right. So overwhelmingly, you guys are jumping on answer C here, and that is correct. So after the site heals, we will rotate the tube daily. Rotation here, again, prevents the buried bumper syndrome. Okay, yep, and sorry, I apologize. There appears to be a couple repeats in this set, so thanks for bearing with me. Not D here, because fluid restriction is going to be inappropriate. But this question might be new to a couple hundred of you. So, all right. Very good. So 31, we're going to 32. All right. Hospitalized toddler has a urine output of 0.8 mLs per kilogram per hour. What should the nurse do first? So basically you need to know, is this normal or isn't it? All right. You guys appear to be kind of all over the place here. So the answer here is going to be C. We're going to reassess in an hour. All right, and I'll give you the rationale. The normal pediatric minimum is roughly 1 ml per kilogram per hour. Okay, 1 ml per kilogram per hour. Okay, for a toddler. So 0.8 warrants a recheck before escalation. Okay, A here is going to be wrong because you don't automatically adjust fluids without confirming a trend. B is wrong because it's just too early. All right, you need to confirm a persistent low output. And it's not D because fluid restriction here is going to be inappropriate. Okay, so toddlers, 1 ml per kilogram per hour is the low end of normal. It's the minimum. Okay, all right, good job to those of you who got that. All right, 6-year-old post-op patient is being repositioned. Which action prevents atelectasis and most effectively? There's Kat. Thanks for sharing the live. I love to see current nurses in here just brushing up on their knowledge. Good to have you. All right, 33 answer here. Pretty much everybody is is staying B, encouraging deep breathing using a pinwheel. Yep. So the pinwheels motivate kind of deep breaths in kids. So, yeah, kids love them pinwheels. Yep, exactly. All right. Good job, guys. I don't think anybody else answered anything differently. Nurse notes that Tyler's BP cuff is covering nearly the entire. Good job, guys. I don't think anybody else answered anything differently. Nurse notes that Tyler's BP cuff is covering nearly the entire upper arm. What is most likely? What is the nurse notes that Tyler's BP cuff is covering nearly the entire upper arm? What is most likely? What is the most likely effect? B, and yeah, that's correct. So when you have a cuff that's too big, you could get artificially low blood pressures. All right. A is wrong because that's usually when your cuff is too small. All right. If it's too small, you tend to get blood pressures that are reading artificially high. All right. So know that. 35. All right. A child on continuous enteral feed suddenly begins coughing and develops increased secretions. What should the nurse do first? What should the nurse do first? 35. Yep, majority of you are saying A, and that is correct. Stop the feeding. All right, stop the feeding because what's going on is probably some aspiration. So we're going to knock that off, right? So that's what you're going to do first. D, right? And so D, with D, positioning helps, but only after stopping the feed. That stopping the feed is the first thing, okay? If you take the time to raise them up, that feed is still going in. They're still aspirating it. So you need to stop the feed first, okay? All right, 36. All right, a nurse assesses a newly admitted 8-year-old with suspected appendicitis. Which action is unsafe? Which action is unsafe? Wow, you guys knew this one. Okay. Yep. C. Applying a heating pad to relieve the pain. So applying heat increases the risk of an appendix rupture. Okay. Heat will increase the risk of an appendix rupture. All right. So, yeah, I mislabeled the top. So it is actually, it's 50 Peds questions. All right. But can't go wrong. People love Peds questions, right? So 37. A preschooler with pneumonia is receiving IV antibiotics every 8 hours. Which observation concerns the nurse most? Which observation concerns the nurse most? Okay, yeah. All right, answer here is B. So that red streaking indicates that there might be some phlebitis and a compromised IV line there, okay? So A, well, many kids scream during flushes. It's not really diagnostic. C, mild swelling from tape tension is not serious. And D, well, that's developmentally normal. Okay, so the correct answer here is B. All right, 38. Okay. A nurse reviews lab values for a child receiving TPN. Which abnormal result is the most urgent? All right, which is the most urgent? Yeah, 100%, right? All right, well, I'm seeing a lot. I thought I was going to see a majority of one answer, but I'd say the majority of you are picking C here, and that's going to be correct, okay? Because right here, sodium is going to trump everything else here. We're looking at a level that indicates severe hyponatremia, which is going to increase risk for seizures and cerebral edema. Okay? So, expected mild hyperglycemia is that's going to be anticipated. All right, your BGL is going to be a little elevated when you're on TPN. B's wrong; it's elevated, but it's not immediately life-threatening. And D, mild LFT elevation is going to be common. So sodium is the most critical thing there. All right. 39. A child with suspected meningitis is about to undergo a lumbar puncture. Which action by the nurse is essential before the procedure? Which action is essential before the procedure? Okay, I'm going to let a few more trickle in here. All right. The majority of you are saying B, and that's wrong. So the answer here is going to be C. All right, start broad spectrum antibiotics. With B, B's helpful, but not urgent. Okay, helpful, but not urgent. C is going to be the answer because we do not delay antibiotics because meningitis progression is rapid. All right, so we need to get those antibiotics started right now. A is wrong because fluids may be needed later, but not the priority. D is just dangerous, okay? We don't want to do that, okay? I swear I only saw C. All right. 40. A nurse is teaching safety measures for parents of a 9-month-old. Which statement requires further teaching? All right, majority of you are saying C. And that's going to be the correct answer here. So C, yes, we can use, so the statement, we can use a baby walker to help with early mobility is incorrect, okay? Walkers are going to increase fall and injury risk and are not recommended. So A is also wrong because magnet ingestion is extremely dangerous. B is wrong, correct safety. It is a correct safety measure for this age. And D, pillows increase suffocation risk. Okay? All right. We are going to 50 tonight, guys. So if you're just joining, it's a little late, but that's all right. Stay for the last 10. But if you haven't already, you can go ahead and follow. We do this every Sunday, Tuesday, Thursday at 9 p.m. Eastern Standard. So go ahead, hit that follow. There's also a lot of other good content on the page. There's a full NCLEX playlist, which is 30 plus parts. And then in the link in my bio, I also have an NCLEX vault of a 240-page doc, which is all cheat sheets and mini quizzes. And then you can also request a custom NCLEX study plan through the link in my bio as well. Those are $25. That's just the amount of time it takes me to do it. Okay? We can talk more about that in a little bit. 41. Answer here is B, which the majority of you got. So check for loose trach ties. So new agitation, plus those mild retractions with a normal SpO2 often indicates that the trach's unstable or partially dislodged. So we need to stabilize those ties, which then will prevent any sort of catastrophic airway loss. Okay? All right, so it's not A. The O2 flow doesn't fix any mechanical displacement. C's wrong because suctioning is done after confirming secure placement. And D's wrong because bronchodilators will not fix a mechanical airway issue. Does that make sense? All right. Here we go. 42. A child recovering from tonsillectomy suddenly begins swallowing frequently. Which action is a priority? All right, this is a different version of a question earlier. All right, should be new to some people. Okay, because what does swallowing early indicate? Or not swallowing early, swallowing frequently, right? And what are we not going to give them? Hey dog, it's me again. What could mask bleeding? Yep, or red popsicles. Okay, we're not going to do anything red. So 42 here, the answer is going to be C. Notify the surgeon immediately. Frequent swallowing equals that there's some probable bleeding, and we need to get that doc involved ASAP. Okay. Answer to 41 was B. Check for loose tracheostomy ties. All right. Why not B? Well, a depressor. So using the depressor could potentially disturb clots and worsen the bleeding. All right. So that's why B is wrong. Okay. All right. 43. A pediatric patient receiving IV vanc develops flushing of the neck and upper chest, but vital signs remain stable. What should the nurse do first? What should the nurse do first? All right. You guys are between A and B. All right. So answer's B. Okay. But just chill for a second. Let me explain. All right. Flushing without instability is likely red man syndrome, which is usually rate related, not anaphylaxis. Okay. So here, A is going to be wrong. Okay. Stopping is reasonable if you're unsure. Okay. But slowing is recommended, and we're not going to call a rapid response. Okay. So the first action is to slow the rate. All right, C is wrong. Epinephrine is only for true anaphylaxis. And D, continuing at the same rate will likely worsen symptoms. Okay? All right, good. Glad that makes sense. Yeah. This one definitely makes you critically think. All right. Very good, very good. 44. All right, a 6-year-old with nephrotic syndrome has periorbital edema and abdominal distension. Which assessment most urgently indicates worsening disease? All right, thank you guys for all the follows. Much, much appreciated. If you guys are in here hanging out, learning something, and you haven't followed, I would love if you did. Lots of good content for you on the page. Trying to help you guys pass the NCLEX is the goal. So anything I can do to help you guys, that's what I'm here for. Okay? Perfect. All right, 44. Answer here is going to be B, bravo. All right. So that decreasing urine output here signals worsening fluid retention. All right, which is an early warning sign for relapse or complications. So it's not A. Proteinuria is expected in chronic. C's wrong because BP is normal for that age. And it's not D because a small gain is not the danger sign here today. Okay? So answer is B. Remember, because generally, well, in peds, we want at least one ml per kilogram per hour. All right, 45. KKK, here we are. A nurse prepares to administer oral liquid medication to a 2-year-old. Which technique is the safest? All right, Danny, thanks for the follow. Which is the safest? The majority of you are saying B, directing the syringe toward the inside of the cheek. That is the correct method here, all right, because that will reduce aspiration risk and improve swallowing control, okay? Don't do A. If the child doesn't drink the full bottle, the dose is inaccurate. For C, flat positioning is obviously going to increase risk for aspiration. And D, well, the full cup decreases dosing accuracy, okay? All right, good job. 46, a 4-year-old with suspected meningococcal meningitis arrives at the ED. Which nursing action is most urgent? Which nursing action is most urgent? Wow, okay. All right, you guys, you've been studying. All right, so, yep. C is the answer here. Initiate droplet precautions. So isolation must occur immediately to prevent transmission. All right, it's not A. It's important, but not before isolation. For B, the LP is going to occur only after stabilizing and protecting others. You guys are smart, y'all. And D, it's just not related to the emergent management here. Okay. Very, very good. 47. All right, a nurse notes an infant's pulse ox consistently reads 84, but the pulse waveform is irregular, faint. Infant is awake and pink. What should the nurse do first? All right. This is a similar question to one we had earlier. Okay. Seeing lots of B's and A's. There's some C and D. Okay. All right. So majority of you are saying B, which is going to be the correct answer here. All right. So B is correct because we're probably looking at cold or poorly perfused extremities, which can cause inaccurate readings, right? So we need to fix the measurement before escalating here. So we're going to check them out. We're going to assess them, okay? So A is wrong because we don't have any true signs of hypoxia. All right, we need to make sure because the question is saying we don't have a good waveform. So we need to fix that. That needs to be a big hint in the question. Your waveforms are regular, faint, which tells me it's not reliable. Okay, so we need to reassess. All right, and for C, yeah, you must assess your equipment. And D, adult probes distort readings. Okay, so that's why it's not D. All right, good job, guys. I think the majority of you got that. All right, Regina, thanks for the follow. All right, a nurse is caring for a child receiving continuous enteral nutrition through an NG tube. The child suddenly develops abdominal distension and increased gastric residuals. What is the priority action? Tell me, guys, what is the most? You guys better freaking get this, okay? You better get this. Nope. Oh. Oh, it's getting late here. It's getting late. All right. Oh, guys. Clock that shit. All right. The answer here is going to be A, guys. We need to stop the feeding. Okay. So stop the feed. All right. Because the distension and high residuals kind of raise our alarm here for aspiration risk. If it's not A, y'all need to go back to school. 100%. No. Period. Clock that shit. So B's wrong because flushing may worsen distension. Okay. C's wrong. Do not continue feeding in any amount until evaluated. All right. And D, warmth does not address the risk. Yeah, let them walk it off, right? Oh, man. All right. 49. Almost done, guys. Almost done. Nurse prepares to administer 0. Oh, that's a new gift. Is that a gift? Appreciate it. Appreciate it. Nurse prepares to administer 0800 medications, 8 o'clock meds to a child who's NPO for a possible procedure but has stable vitals. Which medication is unsafe to give? All right. Majority of you are saying B. And that is correct. All right. Yeah. So the oral anticonvulsant is going to be the one that's unsafe to give. So if a child's NPO for sedation or procedure, oral meds must usually be held unless explicitly ordered otherwise. So for A, IV antibiotics are safe and necessary. For D, maintenance fluids are going to be expected. And D, inhaled meds don't violate the NPO status. Okay, so there you go. Tia says, oh my gosh, this is so helpful. NPO means nothing by mouth, Marina. Nothing by mouth. All right, 50. A 3-year-old with a history of difficulty airway begins coughing violently during a nebulized bronchodilator treatment. What should the nurse do first? What should the nurse do first? All right, guys. And after we go over this question, stick around for 2 minutes after we are done with this question. Hey, for those of you taking your exam Monday, you got this. All right. Seriously. If you haven't already looked at my full NCLEX review playlist, there's literally about 33 videos, a couple minutes apiece. Binge them. Binge them either tonight or tomorrow. All right. And then slow down and rest the weekend. Okay. All right. Very, very good. Let's see. The majority of you are saying A. There's a lot of A and D here. And the correct answer is going to be A. We're going to stop the neb treatment to prevent any worsening airway irritation, which could lead to any sort of possible obstruction. Okay. It's not D because coaching breathing here doesn't remove the immediate trigger. Okay, the trigger here is the neb, so we're gonna knock that shit off. Okay. All right, I don't have a 51. All right, so you guys killed it. Stick around here, 2 minutes. So for those of you taking the NCLEX here that are usually with a date more than 2 weeks out, I do offer custom NCLEX study plans, which you can find via the link in my bio. And essentially what that is a plan tailored to you and whenever your test date is, all right, and it takes your life into account. So the amount of time you have to study on weekdays versus weekends is different. And so the study plan will tell you what to study each and every day. And it gives you, it breaks it into blocks every single day. So it takes the guesswork out of what to study. And if you're a repeat test taker, I take your CPR into account too. All right. So I do these plans for RNs and LPNs. So you can check that out. And again, that's via the link in my bio. They're $25, but that's just to cover the amount of time it takes me to do it and individualize it to you. Okay. Yeah. Oh no, you thought it was 9:30. I'm sorry. No, I switched to 9 because I'm staying up too late when I'm starting at 9:30. Thank you guys for following. If you guys haven't, I'm going to stay on for another minute or two. If you guys haven't already followed, you can go ahead and follow up there. Yeah, these will definitely help you on not just the NCLEX, but just studying for a nursing school exam in general, because we're doing questions that are similar. NCLEX questions are similar questions to nursing exam questions, which are similar to HESI questions. So, it all, as long as it's, a subject that you're curious about and want to learn, I will be doing 1 to 2 subjects in each um, live. So yeah, the study plans do account for repeat test takers. I saw that question in there. You want to do? I've seen a lot of questions for case studies and stuff, and I'm trying to figure out what best format to do that in. So, yep. Awesome. I'm glad you found me too. It's all right, Elias. I failed the first time as well. So it's a detour, not a destination. All right. Everybody in this chat right now will become a nurse. 100%. You stick with it and you just keep grinding away. You will pass. 100%. You will pass. Just stick with it. All right. It sucks to fail. I've been there. I did not have a good plan the first time. I was just like, oh, I'm going to just, devise my own plan. I'm going to do a study book. And I wasn't great about holding myself to it. But everyone's different. I'm not going to freak anybody out by telling you what I did my first time. But the second time around, I had a plan. All right. I did a lot of questions. And I wish I would have found something like this to do reviews with and have kind of a community to talk to. So I do this every Sunday, Tuesday, and Thursday at 9 p.m. Eastern. All right. So you take your NCLEX at the end of this month. All right. I really highly suggest a study plan if you're up for it. Okay. It really does help you shore up all of your weaknesses all together. All right. Oh, you are doing a study plan. Well, fantastic. I just, I don't know you by your screen name. Awesome. I've dedicated my life to it. Hell yeah. That's what I'm talking about. All right. You're amazing. You graduate next week, Julia? Fantastic. And Shula's still waiting on her authorization to test. It's all right. It'll come. I don't do one-on-one sessions. My main and most helpful offering is the study plan. But the NCLEX Vault, also available via the link in the bio, it just asks for an email address, and then you're in. Is like cheat sheets, mini tests. So, yeah. All right, utilize ATI, NCLEX project. There's also an NCLEX app. Yeah. When I did pass, I used UWorld and just basically went through the entire question bank. But even that is not the perfect practice. You got to do a lot of content review. I wish I would have had a little bit more structure. So, all right. I mean, all of these things can be helpful, like boot camp, Archer, simple nursing. I've seen and have talked to people who pass using all of them. Every single one can help you pass. It's more or less how you use it and how dedicated you are. All right. So you guys are very welcome. Yeah, I love that you guys are using the chat to kind of talk back and forth and help each other out. Yeah, UWorld is the question bank I use. They've got, I mean, all of these are generally similar systems. They all offer question banks and predictor tests, and it's just pick your poison. Usually it's which one fits your budget the best, yeah. So ATI, Hearst, some of your schools probably have agreements with the bet with whatever thing and might be free to use. So use that, but have a plan. Have a plan to do it. All right. Absolutely, Stormy. Absolutely. All right. Well, I'm about to jump off here and go take a shower, and I will see you guys Thursday. If you guys are still not following, go ahead and follow. And yeah, I post videos daily. So I got a good rotation of study videos, NCLEX videos, actual like covering a subject, some humor, things like that. So try to keep it fresh. Okay? All right, Maureen. Yep. We'll see you Thursday. All right, guys. Adios.